Welcome back to Scissors and Scrubs. We're going to do a episode that's very personal to both of our hearts today. So, Laura and I had a procedure done.
Yeah.
A little while ago.
Really, I mean, procedure.
It's a procedure.
All right.
We both had facelifts. No, I'm kidding. We didn't. Imagine if we both walked into work tight as shit.
Same time.
Hi. No, we didn't have facelifts. Okay. So we had a procedure called Neogen done, which is like a facelift, but with nitrogen, plasma,
nitrogen gas, which is it turns.
So
yeah.
Laura's going to get into the details of it, but it was a process.
Yeah.
You're very shiny,
because
you have to lube up with Aquaphor 4 times a day. Do you know what you look like when you've been lubing up with Aquaphor for 4 times a day for 5 days?
It's not pretty.
And you can't wash your hair.
Yeah.
Because the Aquaphor seems to migrate into your hair.
Yeah, you try to avoid it and then there's just hair stuck across your face.
I had 3 people say to me how good my skin looked. And I burst out laughing like, you have to be making fun of me because
I have goop hanging from my
it's like almost dripping off my face.
Yeah.
And somehow, with all that goop on, your skin can still peel.
Yeah.
I can't believe it. So, Brian went to give me a kiss the other when I was going on with this. I'm like, he's gonna slide off my face, and you're like, because it's like all over my lips because it was peeling around my lips, and he's like trying to get. I'm like, just don't get me wet. He said, what do you think I'm gonna do? I'm like, I can't get wet.
No.
Of course, the night that we were out, it was during my daughter's competition. It's pouring rain out. I'm like, I can't get my face wet. So I took her reward, which was like a almost like a poster. It was thick. I have it over my head running in the wind. I'm like, so today we're going to talk about different things to do to your skin that is not a facelift to help you make it look a little younger.
Yes.
Help with bags, help with wrinkles.
Life in your face.
A little more life in your face. Yeah. So Laura's going to discuss first what we had done.
Yes. So we had a Neogen plasma. So Neogen plasma skin regeneration is an FDA-cleared, non-surgical skin rejuvenation treatment that uses nitrogen plasma technology for skin tightening, regeneration, and resurfacing. It can boost elasticity and firm tone and smooth skin on the face, neck, and body.
I might have to try this shit in my stomach.
I want to see it. Like, I want to
see how it looks.
Yeah, I'm going to see.
It takes a while, which is why I was saying that. It takes like 4 months for you to get your full effect. Maybe 6 months.
Yeah. So it works by converting inert nitrogen gas into plasma energy. Thermal energy pulses are emitted via a handpiece, rapidly heating the underlayer of the skin, like the dermis layer.
It smells like burnt skin.
It smells like a bovie.
And it sounds like, it's like poop, poop, poop. And when you're near your ear, it's really loud. I was like, oh.
She's like, was it like a laser? I'm like, it was like gas, like poop.
Yeah.
Like, I'm like, she's probably like, what does that mean? Then I'm assuming when you got there, you're like, oh.
Yeah, no. It literally is like, poo, poo. Yeah. It makes this funny sound.
Yeah. The heat creates controlled damage that triggers your body's natural healing response, creating new collagen and elastin that delivers some immediate skin tightening with increasingly firmer skin over the coming months. Even at high energies, a Neogen plasma treatment doesn't fully remove the skin's surface, like other ablative laser treatments often used for the same results. It maintains a protective layer that encourages more rapid healing and prevents the risk of infection. This acts as an insulator and a natural biological dressing post-treatment. So by leaving the outer layer of skin intact, it lets the inside heal better. Within 3 to 5 days of a high energy treatment, because you can have high or low, skin regeneration begins and the damaged epidermis sheds as the new upper layer of skin appears to replace the treated epidermis. Improvement in skin tone, texture, and firmness continues for as long as a year after treatment.
Oof.
At lower energy, I know, me too. At lower energy levels, the stratum corneum, which is the outer layer of your skin, shed in about 1 to 2 days. Unlike laser resurfacing, Neogen plasma isn't dependent on chromophore or color target, such as like excess brown pigment. It treats the entire skin architecture all at once in a single treatment. All 4 types of collagen are treated, not like fractional laser where just one type is produced. You also won't need ocular guards or any sort of eye protection because this is not a laser and cannot damage your actual eyeball. It reduces the appearance of fine lines and wrinkles. It improves skin texture and tone. We were told one treatment. A bunch of the stuff I was reading does say like you can have more than one treatment. The provider customizes your treatment settings to your skin tone, your concerns, your goals, and like how much downtime you can have. There's common concerns that are treated by the Neogen include fine lines and wrinkles, skin laxity, excess pigmentation, age spots, and other signs of sun damage, scarring, including acne scars. They can like do a great job on acne scars, active acne, loose skin on the upper and lower eyelids, and seborrheic and actinic keratosis, or like benign skin lesions. Pros of the Neogen: the treatment can simultaneously address all of these problems on the face, neck, chest, and hands. Your provider can customize the level of energy for your skin concerns and your desired results. So it's not like one treatment for everybody. Like it's very customizable. Low energy treatments can be used safely on all skin types and tones. A lot of people with darker pigments cannot have certain lasers because it won't pick it up or can damage it more. This treatment is safe for all skin tones. And while it's not a substitute for surgical eye lift or a blepharoplasty, it can be used to perform a soft, quote unquote, eyelid lift. And studies show an average contraction of eyelid skin of 22%.
Ooh, that's
pretty good.
I'm hoping.
The treatment preserves the outer layer of skin, like we said, which is a pro because it acts as a natural protective dressing as your new skin forms underneath. The studies show that it comes with less downtime as well as fewer safety risks and potential complications than fully ablative laser resurfacing, while delivering very comparable results. Results can last for a year or longer depending on your treatment's energy level and how well you take care of your skin afterward. There is no volume or fat loss associated with the Neogen plasma, so you're not going to sink in or anything. And results continue to improve for 12 to 24 months. There are cons. You may need a series of treatments to achieve your desired results. The high energy treatment is best suited to those with fair to medium skin tone. So if you needed a high energy and you had a darker skin tone, you might not be able to do it. You might just have to have a low. Patients with high sensitive melasma may not be good candidates. Even with topical anesthetic, which they numb the shit out of your face, it feels like there's a brick. It literally felt like your face was a brick.
Like, woo!
Yeah. The high energy treatment can sting like the snap of a rubber band. Most patients find it tolerable, but on the first day after treatment, the sensation can feel like a sunburn. I just thought it felt hot.
Right. And it was only for like 2 hours for me.
Yeah.
It felt hot.
Oh yeah, it was done by.
Ideal for me was watch yours.
You may need up to 10 days downtime after high energy treatment, including significant peeling for several days. As with other skin rejuvenation procedures, results aren't permanent. You'll need follow-up treatments to maintain at some point. How much does it cost? Average cost, $1,972. Range, $750 to $3,300. The price you pay depends on
where you go,
who's doing it, credentials, reputation, location, what state you're in, you know.
It's like Botox. You can get Botox for $10 a unit. You can get charged $20 a unit. Depends on where you go.
So say you go to get a Neogen, what happens? The full treatment takes about an hour. But if you just were treating like one ear, you can just treat like just your eyes. Mm-hmm. That takes like 10 to 15 minutes. They'll apply a numbing cream to the treatment areas. Once you're numb, again, you're going to feel a little something, but it's not.
It didn't hurt. I don't think it hurt.
You don't have to be worried about pain or anything. The provider is going to literally they go like in a grid, all over your face.
You know how you'll know? Because when you're done, you're going to see every place that she hit it.
And they will adjust the energy level and the number of passes. Yeah. Like if you have I hate my under eye line, so they went over that more than they went over some areas.
It was my jawline, and she did my jawline a few times.
So, they customize what you want done. Recovery, you'll need 1 to 10 days of downtime depending on the energy level of your treatment. Low energy treatments have a minimal side effects and downtime, while the effects of the high energy treatments are similar to those to a bad sunburn, which immediately post-treatment will make you look inflamed and mildly swollen. I was definitely swollen. Then it will darken over the next few days as the damaged skin becomes crusty and begin to peel. Your skin might also itch and feel dry and tight.
Yeah, I'm itchy, dry, and tight.
Yeah.
I haven't really peeled a lot.
I peeled, but it's still tight and dry. Post-op skin instructions typically include avoiding moisturizer and products, except for like petroleum jelly ointments. That's why we use an Aquaphor to encourage the dry skin to naturally slough off. Once the peeling process is done, you can resume your regular skin routine. You start with like gentler stuff, but then you can go full throttle after 30 days and do your retinols and all that stuff. You see results over time. You may see some skin tightening immediately with improved firmness and more youthful appearance for up to a year after treatment as collagen and elastin regeneration continues. Skin resurfacing results appear within 10 days once you're done peeling. The new skin emerges smoother, more evenly toned, and more youthful. The skin does immediately look just lighter, I think. And that's about it for a Neogen.
So when I went in for mine, the woman who did mine she was 5 days out. She looked a little rough, I'm not going to lie. But we were talking, and first she had said something you should do every year because even though it lasts, she's still aging in that process. Yeah. And I said, so what do you do to get all this stuff off when you're done? She's like, I get for a nice chemical peel. Oh. Then I asked her how much it was. I thought, I'm not getting a chemical peel. But we will discuss chemical peels.
Okay.
If I was no children at home, I might have followed this up with a lovely chemical peel. Mm-hmm. I got my information from Mayo Clinic. So chemical peels are a procedure where a chemical is applied to the skin to remove the top layers. The skin grows back smoother. Light or medium peels may require more than one treatment for desired results, or you can have a heavier peel. Every single treatment we are talking about, or any of these treatments with chemicals or heat, is designed to give you a controlled wound. Mm-hmm. And your body is responding to this wound by producing stuff you don't normally produce anymore in our age groups. Like how I worded that?
Yeah. Mm-hmm.
In our age groups. Because basically you stop making collagen and elastin like in your early 20s, and then everything caves. So
everything just falls down.
We just continue to burn the shit out of our faces with whatever we can get our hands on to make it look younger. And chemical peels is one of them. So a superficial peel, it's going to remove the epidermis. It treats fine wrinkles, acne, uneven skin tones, and dryness. And you could do one, like you could go every 5 weeks and have one of these done. And you're not going to have any damage. Mm-hmm. A medium peel removes the epidermis and the upper part of the dermis. Again, for wrinkles, acne, uneven skin tones. And you're going to need maybe more than one for desired results. And it's not something you're going to be doing every month. Mm-hmm. A deep one that goes into the dermis. It's for deeper wrinkles, scars, precancerous growths. You'll only need one for the effect of these things. These require anesthesia.
This is a burn.
It is. They are burning off your face with acid. Chemical peels don't remove deep scars or wrinkles, and they are not going to prevent sagging. So if you want a facelift, you're not doing that. A chemical peel is to make your skin look healthier and get rid of the dryness or old dermis.
It's to grow new face.
It's to grow new face, dermis layer. It makes you look healthier. As you age, things that are going to make you look healthier is moisturized skin, even toned skin. Mm-hmm. You want to get rid of all of the, if it would be something I would do in the spring, get rid of all of the winter dry skin off my face. I might do it in the fall to get rid of all the sunscreen and just really start fresh. So risks. There is redness, scabbing, swelling, scarring. You can have changes in skin color. You can have hyperpigmentation or hypopigmentation. You are more common to have hyperpigmentation, be redder, things like that from a light peel, and hypo, where your skin gets more you don't see much from a deeper peel. These can also cause you to have an outbreak of cold sores because they will bring out any of these procedures. If there's heat involved or some kind of, it will activate a cold sore. So you got to be careful of that. You might want to take something beforehand. You can have heart, kidney, or liver damage because they're using carbolic acid in a peel, and it can damage heart muscles and cause irregular rhythms. Avoid taking oral acne meds. You don't want to be taking Accutane and go for a chemical peel. If you have a history of creating keloid scars, none of these procedures are going to be up your alley because you will keloid over it and you'll look awful. You don't want to have it done if you're pregnant, or if you have frequent outbreaks of cold sores, because it could make it worse. So before getting a peel, you might need an antiviral because of your cold sores. A lot of people, is it Valtrex, I think they take ahead of time. You can use a retinoid cream to help with the healing. I don't know how that helps, but it does.
I know, you think it would burn
You
it
think
more.
it would be, exactly. Avoid sun exposure. It can cause irregular pigment in treated areas. 2 weeks before, no electrolysis or depilatories, nothing pulling your skin out because it's going to create little wounds. No hair dyeing treatments or perms, no hair straighteners, no facials.
That's with any of these.
Right, no facial masks or scrubs for a week of a peel, and no shaving for 24 hours before. You don't want to have open wounds in your face and then put carbolic acid in it.
Oh.
Right. If you're going for a deep peel, now, I preface this story with, we used to work with this woman a million years ago. And, I mean, she was probably in her mid to late 60s. She looked great. But she had come back after having this kind of a peel. She was terrifying to look at. Oh. And she came to work like this.
Oh, God.
Because I think it takes months to heal. She had gone out and had this done, and her face it looked like somebody just took tomato sauce and put it all over her face. Oh. That's how red she was. Yeah. I mean, her skin looked amazing afterwards, but holy shnikes.
It's not for the faint of heart.
It's not for the faint of heart. So a deep peel, it requires IV sedation. Mm-hmm. It's to limit the exposure to the acid. You might want to do, like, the doctor will do it in 15-minute intervals, and it could take over 90 minutes to get this done. When you're doing a peel, they're going to clean your face, blah, 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 and then they just take the chemical on a cotton and they just rub it on your skin.
And we'll do it in plastic surgery, like when people come in to get certain things done, then they'll do a chemical peel at the end.
Yeah, I love them. After the peel, your skin will be red, irritated, and swollen. Yeah. So after a light peel, it could take 1 to 7 days to see the results. A medium peel could take about 14 days of peeling to see results, and to heal. And you could be red for a few months after that. A deep peel, you might need painkillers post-op, dressings for the redness. Dressings, and the redness could last for months. You will need downtime at home while you're peeling from these kind of peels. So in my days as I work in a spa, we had gotten this peel kit to try, Tara and I had gone and we tried on ourselves first and then you use people. So we had done a demo on each other and done the peel. Totally forgot I had done this peel. And the peel would activate in 2 or 3 days when you got hot. So if you were working out or something, it would kick it in. Again, I totally forget I have this peel, so I'm at work and I am melting in the room because we're moving patients, this and that. And the anesthesiologist looked at me and she's like, "Did you get a sunburn?" I'm like, "No, why?" She's like, "You're peeling." And I look in the mirror and I was like, oh my God. It was in my eyebrows, in my eyelashes. And it wasn't like peeling at sheets. It was all that fine. Yeah. Oh my God. I was mortified. I'm like, oh my God, I totally forgot. And you can't pick at it.
No, you have to let it go.
You can't scrub it off. So I was an idiot. How do I forgot I had done this? But I completely forgot I'd done it. I was mortified. Oh
my God.
And then, like, when you're doing it, your face gets real tight before it peels, and it's itchy, and you want to scratch the shit, and then it just pops like a zit, and you just start peeling. So yeah, that's chemical peels in a nutshell.
Lovely. Maybe I'll do a light one, a mild one. All right, so I was going to do CO2 lasers, and then Nicole's going to do Fraxel lasers, but it's kind of like I'm just going to go, well, it's not, but we're going to compare and contrast.
It was going to be repetitive information.
Yeah. So a CO2 laser is a type of laser that emits infrared light at a wavelength of 10.6 micrometers. A fractional laser, or Fraxel is like the brand name that we know by, is a type of laser that creates micro channels in the skin, leaving healthy tissue between them. So how they work, a CO2 laser ablates or removes the top layers of skin, stimulating collagen production and reducing wrinkles, scars, and hyperpigmentation. A fractional laser creates tiny, precise wounds in the skin that trigger the body's healing process, resulting in improved skin texture, tone, and elasticity. So the CO2 laser literally removes the whole top layer. The fractional makes little teeny wounds to encourage it.
I've had a Fraxel done when I took my laser class. We had to do that, and I don't know what it was, so I got volunteered to do the Fraxel. Your face is on fire for like 8 hours. Like fire.
Oh.
I was dying. I'm like, nobody told me it would be this hot.
Yeah. The areas that they treat, the CO2 laser is suitable for treating deep wrinkles, scars, skin laxity, and skin cancer. A fractional laser can be used on a wider range of skin concerns, including fine lines, wrinkles, sun damage, and acne scarring. Recovery time for a CO2 laser requires a longer recovery time. It's up to several weeks due to the deeper ablation. It is literally burning off
resurfacing your face.
And the fractional laser has a shorter recovery time, usually just a few days, because it leaves healthy tissue intact between the microchannels, so it's not burning off your whole outside of your face. Side effects of a CO2 laser may cause redness, swelling, crusting, and scarring. And side effects for fractional are redness, irritation, and temporary dryness. Cost. CO2 laser is generally more expensive due to the deeper treatment and longer recovery time. Fractional laser may be less expensive depending on the specific treatment area and depth. And again, it depends on where you go, who's doing it, what state you live in.
Are you sedated for the CO2?
I don't think so.
I think you're right, because I thought one of them you sedated for it. Go ahead.
I mean, that would be nice of them.
Yeah. I mean, it's not going to be a good time.
Other considerations for these. The fractional CO2 laser is a combination of CO2 and fractional laser that provides deeper penetration and faster recovery than traditional CO2 laser.
Oh.
And there's an erbium fractional laser, which is another type of fractional laser that uses a different wavelength and is less invasive than a CO2 laser. So there's other options, like you don't have to peel your whole face off with a CO2 to get kind of the same results. CO2 lasers are stronger and they're better for like oilier or thicker skin to use. Fractional lasers work well for sensitive or lighter skin. And they reduce the potential for dark spots and scarring.
Lovely.
Yeah. So you can get either of those two.
All right. Well, we're going to now move on to IPLs. IPL is one of my favorite things. But you need to know you're going to somebody who has a good laser to do this. Actually, it's not a laser, excuse me. A good machine, I should say.
Good light.
A good light.
Mm-hmm.
I've had them done in the past, and I really like them. But IPLs, it is intense pulse light. You cannot do it on people of color. Mm-hmm. And when I say of color, we're talking even Middle Eastern, if they're too dark. You cannot do it if you have a tan. You cannot do it if you have tanning creams. I'll repeat this again later on. You can't do it in the summertime. So usually you wait till like the dead of winter when you're as pasty white as you could be, and then you have it done. But if you continue to go out in the sun, everything you just removed will come back. Mm-hmm. Those are the downsides. But an IPL, WebMD, stands for Intense Pulse Light. It's also known as a photofacial. I recently had a BBL, not a Brazilian butt lift, but I believe it is broadband light. So they introduce more wavelengths into your face. It helps improve visible signs of sun damage. So, as we used to call them as kids, those liver spots on your face and your hands. When you hit maybe about 40, 45, you'll start noticing on your face, especially like if you drive a lot, you'll see it on the side you drive on, or it's around the hairline, you'll just see the little brown discoloration starting to pop up. Quickest way to age somebody is your brown spots. So they're on the face, the hands, the neck, or the décolleté. It can also help with rosacea. And the difference between an IPL and a laser is the IPL is more gentle on the skin. It is not a laser, it is light. A laser is a beam that goes through like a gem that creates this laser light source. This is actual like a big bright light bulb. It is softer, but you usually do these in a set of 3. IPL sends out multi-wavelengths of lights which can treat a variety of skin issues. So it's not going to, it sees browns, it sees reds, it does not see whites. So if you are going, you can use this for laser hair removal, but if you have very light blonde hair, if you have white hair, it will not remove them. It doesn't work on that fuzzy, the peach fuzz in your face. It won't work to get rid of that because you can't see it. When your skin is heated, your body again goes through this burn response and it gets rid of unwanted cells. It works like a controlled wound on body responses by generating new cells. It makes you look younger because even skin tones is makes you look younger, as does white teeth. It's weird the things like because people you whiten your teeth and you try to get a even tone to look younger and you have to want to be hydrated. It works best with pale or light brown skin. You cannot use it. If you were to use this on somebody with very dark skin, you're going to bleach their skin. You're going to turn it white, and that's not good. It helps with acne, birthmarks, stretch marks, liver spots, also known as age spots, broken blood vessels, dark spots from hormones. It works on melasma, not great. Melasma is that like some women get that mask when they're pregnant. That's very, very, very difficult to treat. Yeah. It works for discolored skin, fine wrinkles, freckles, rosacea, scars, spider veins, and unwanted hair. Do not get one if you are sensitive to light, or you have any kind of photosensitivity, you have any kind of a tan, or you're using tanning creams. You do not use it if you have any kind of skin cancers on your face. If you're using retinoids, if you are very dark skinned, if you have skin resurfacing disorder like keloids, or you have severe scarring, or you create keloids. It takes up to 3 treatments, and you will see a reduced redness or spots 50 to 70%. Wow. Broken blood vessels can disappear, but new ones can reform if you do not stop. And I'll get into what I mean if you do not stop. 70% reduction in brown spots, but they'll come back if you go back out in the sun. 90% of people with acne scarring see positive results. Wow. Side effects. You can scar. It hurts a lot. It's like somebody taking a rubber band and smacking it on your face, and the light kind of makes you jar because it's so bright. You're wearing eye protection, but it's so bright. And then they're flicking your face over, and it's hot, over and over and over. I hate it. But I like the results. You could potentially bleed. It could become infected. Anytime you've left an open wound on your face, you don't want to be picking up your cats. You want a clean face pillow. You don't want to be touching your face. You've got to protect it. It can cause a change in color. It can get crusty, or it can blister because you are basically burning the skin. The recovery. Your brown spots will continue to get darker and darker and darker over the few days and then eventually peel off. You will feel for about 4 to 6 hours like you've had a very bad sunburn. While healing, avoid makeup, especially if your skin hurts. Use moisturizers. You want to use sunscreen of a SPF 30 or higher and apply it every 2 hours. I have to remember that this summer, right? I'm going through all this work.
Yes.
But I'm never going to not go in the sun again.
No.
You want cleaners for sensitive skins. Don't use harsh abrasive cleaners on your face. Don't be doing a dermabrasion like 2 days after you've had this done, because that would be bad. And that is my information on IPLs. Here's my story on IPLs. So, back in the day, I performed IPLs on people. My girlfriend wants her husband to come in for an IPL. And he had weathered skin. It was so weathered, and he maybe likes wine. So it was purple.
Yes.
And he had broken blood vessels. So she tells him this is going to be 15 minutes and it doesn't hurt. Incorrect.
It's quite the lie.
It's quite the lie. It takes like an hour and it hurts like a motherfucker. So he comes in and he tells me this. I'm like, all right, it's going to hurt. And you need down. Oh, no, just do it. Just do it. Now, this man is also a lawyer, which is why I tell you this story. So I'm already nervous because he's a lawyer. So I'm hitting him and he's losing his shit. But as I'm doing it, the purple is disappearing. I've never seen it. Was the results he was getting were drastic. But when you hit the veins, which I knew this in my heart, but when you see it and you hadn't seen it before, I had a stroke. When it hits the spider veins, it coagulates the blood in the vein. So they turn black. Oh, God. Okay. So now you have red spider veins turn black. They will disappear in a couple of days.
Right.
But they turn black. But the purple was disappearing. So he has now lost his shit because it hurts so bad. Now he needs a recovery, and he's got black spider veins on his face. And I went home and I said to my husband, we're going to be sued. And he's like, what? And I told him what happened. And I mean, we knew them socially as well, but I'm like, we're going to get sued. He's going to sue my ass. It's happened. I didn't sleep for 3 days. I'm like, he is going to sue my ass. A week later, he wanted another one.
Wow.
And I was like, his wife called and said he wants another one. I said, he has to call me himself and tell me he wants another
Right.
one. And he called me. He's like, yeah, I was really angry with you when I left. He goes, I was pissed.
Mm-hmm.
He said, but then the results were unbelievable. And now I want another one.
Yeah.
I was like, okay, as long as it's coming from your mouth. But holy shit, I thought for sure I was losing my house.
I know, but like how, like, it's not like something you didn't explain was going to happen.
I know, but I think people, no matter how much you explain stuff
Yeah.
to them, like even with Botox, people come in and they think you can give them a facelift with Botox.
Right.
You can't.
No.
And then when that doesn't happen, they're like, oh, well, I still got this. So I take photos before. I'm like, well, that's what you looked like when you came in.
Right.
And I can't pull your face tight. Like
Right.
you have to have realistic results. But I also think, and I'm not saying this person was one of them, but a lot of people, we're doing it for completely different reasons. We are well aware of who and what we are.
Mm-hmm.
I think people, there's a little body dysmorphia that
Yeah.
shows up in plastic surgery. I mean,
Yeah.
we know this. But they scrutinize themselves in the mirror.
Mm-hmm.
So things you wouldn't even notice.
Right.
Like I never get in the caveat when they come in like, what do you think I should do? I never answer that question. What bothers you when you look in the mirror?
Right.
Because I'm going to pick out something that I'm like, oh, you've got this gigantic line down your forehead. Yet that doesn't bother them.
Right.
They're like, can you get this zit on the... I'm like, that hatchet mark isn't bothering you
Right.
at all? You want that?
Right.
Oh, yeah,
Okay.
sure. So I now keep my opinions to myself. But I've learned the hard way. So, yeah. So that is, they're good procedures. They do help with anti-aging. I am not ready to go under the knife. I don't think I'll ever be ready to go under the knife.
If you could do it with like lasers and stuff like this,
I would rather.
Yeah.
I'm not criticizing anybody who does.
No.
You get amazing results, but I'm not ready to do that. I don't think I'm ever going to be ready to do filler. I love my Botox.
I
I'll
don't
do
like
my
a filler.
Botox. It's just, to me, filler is really expensive.
It just makes me nervous.
I think, and I don't feel there are very conscientious people out there doing it, but there are also people who just keep filling, no matter how bad you look.
Well, and I think it's like one of those things like you have it and then, it goes away eventually but it's not fully gone.
Right.
And then you
It's
get
like
the
a
same
step.
amount. So then it's more. And then but you're like, oh, but this is a little deep. And I feel like that's when you start to look a little too done.
I went to breakfast the other morning with my girlfriend, and this woman walked in. She had to be like, I'm going to say mid to late 60s. I wanted to go over to her and say, you have got to stop filling your face.
Yeah.
You look ridiculous.
Yeah.
And she thinks she looked like she couldn't move her face.
Yeah.
She was so overfilled. And who is still putting it in?
Because you're paying, so they'll do it.
Exactly. And I hate that. She looked ridiculous.
I know.
And, her mouth's curved up almost to her eyes. She looked like the Joker.
Yeah.
She looked ridiculous. And if she walked in to me asking me, I would be like, absolutely not. You are so overfilled. You have to let some of that
dissolve a little.
Right. But then you're going to have saggy skin.
Right. Because
now you've
that's why we have that, right?
Right.
Like my face used to be full. Now look at the dip in between.
Well, did you see people taking the bulk of fat out?
Yeah.
So they can have that?
What
are you going to look like when you're 80?
I know.
You're going to look ridiculous.
Like it's gone. I know it's gone. I know it should be filled, but I just like that to me is just.
I was working with one of the surgeons the other day. Nicest man in the world. I've met him 3 times. We talk like we've been neighbors for years. And we started talking about plastic surgery. I don't know why we were talking about it. And the girl from the Queen's Gambit, I never know her name.
Oh, yeah.
She had that done. So he's like, we're supposed to be prepping up. He's like pulling up his phone. Like, look at the before and afters of her. She looks ridiculous. So she can have
she had
prominent
the fat removed.
She had the fat removed to make her cheekbones
Just wait,
pop.
lady, till you're 40-something. It's gone.
But they don't see that.
Look at this. Nothing.
Right. And isn't there somebody saying, this is what's going to happen? You're going to get that naturally?
Hey, look at this picture of Laura. This is what your face is going to look like by itself. You're going to need something in
Laura,
there.
I'm starting to look my brother who was cacactic. Okay. All right. God bless him. May he rest in peace. In the end, he was not. I look in the mirror and I'm like, oh, I look like an HIV patient.
I'm telling you that did I say that too? I was like, look how far back my eyes go. I mean, I like to look cacactic, so I was.
I do not like to look,
but
because
it
all
comes
I
back.
see is my brother and his deathbed.
Yeah.
I'm like, oh, I've achieved that look. Now.
It will obviously pop back.
Yes. So don't do crazy procedures. Research anything you go into. Some of these lasers, they may just have you in, do a consult and do a test spot on your arm so that they can see how your body's going to react to the laser, so you don't do your whole face first. Research, find good, competent people. They're out there. But don't be too afraid because, there are some good stuff out there. Yeah. I love a good chemical peel.
Listen to directions.
Yes.
They give you if you're going to do it,
do what
then
they
do
tell
everything
you to do.
they're supposed to do. You have to hydrate. You have to do this.
Yeah.
You have to use this certain stuff. Like, just do it because that makes a difference on the outcomes. Like,
Right.
you're not going to get the outcomes if you're not doing everything that you're supposed to
And
do.
like this particular one, we have to be patient because it's 4 months that it's going to take to get, like, we're not going to get instant
I'm
results.
not patient.
I know,
so.
but we have to be patient, which is very difficult because a facelift, you have immediate results.
Right.
This is going to take time. All right. So that is that. We're getting into the summer. If you want to be part of our world-renowned summer series, give us some stuff to write about. And we'll see you soon.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.